Dr. Rishabh Mishra. We'll give that chance for anyone who is give them chance to present afterwards. Rishabh Mishra, he will be presenting on DAVS versus conventional analog microscope, our experience at tertiary care center in Eastern India.
Good afternoon, everyone. Today's topic for presentation is distally assisted vitreoretinal surgery versus conventional analog microscope, our experience at tertiary care center in Eastern India. As retinal surgery is a very intricate procedure in which we need a high level of dexterity, so we need a good visualization system. In our study, we used a Ingenuity system from the Alcon, in which the eyepiece lens is replaced with high definition camera, which project the image on 55-inch screen that can be seen by polarized glasses. In analog microscope, we use OPMI Lumera T, and PP machine we use is Constellation from the Alcon. This study is prospective hospital-based cross-sectional observational study in which we take 10 participants, 5 were the postgraduate senior resident and 5 being the vitreoretinal surgeon. We perform the 5 surgeries on each platform in which we perform pars plana vitrectomy followed by retinal detachment surgery and macular hole surgery. At the end of surgeries, each participant was asked to fill a questionnaire that was pre-designed questionnaire that was tested on 10 observers who were similar in experience to the study participant. The final questionnaire included the 10 items under the 4 sections, namely level of comfort, clarity of image, stereopsis, and understanding of the surgery. Replies of these questions were arranged according to Likert scale from 1 to 5, with 1 being the strongly disagree and 5 being the strongly agree. So it is quite evident in our study that 60% participant felt discomfort while using the cam, while the 20% participant felt discomfort using the DAVS. 70% participant achieve a good stereoptic image while using the DAVS, while 20% using the same with the cam. So the surgical steps understood by the 90% population understood the surgical steps very well while using the DAVS, while 60% using the cam. 70% participant preferred to further watch the surgeries by the DAVS platform, and while the only 30% preferred to do so with the cam. So it's quite evident from our studies that DAVS has many advantages over the cam, like better stereopsis, better depth of field, enhanced field of view, and better resolution and improved ergonomics. So there are some limitation of my studies, that our questionnaire were designed that way that they have given the equal weightage to all, and the questionnaire were prepared based on the opinion of retina surgeon experienced in using the DAVS platform. So the conclusion, DAVS is actually DAVS is a better learning and teaching tool as compared to the cam, and that can be a game changer in the vitreoretinal surgery. These are some of my references, and thank you.
Do you have the questionnaire?
No, ma'am, I don't have right now.
So at least to me, it is not clear whether you are analyzing the surgeon who's operating, whether you are analyzing the operating, the experience of operating on the DAVS, or you are analyzing the somebody watching the surgery on DAVS passively.
Actually, I am analyzing the surgeons who are watching the surgeries.
So somebody else is operating, they are only watching.
Yes.
Okay. So then the discomfort and all you have mentioned about the seating posture, ergonomics, that is for surgeon or for the person who is watching?
For surgeon especially, not for the observer actually.
But your questionnaire was for the observers, right?
Yes.
But you have talked about ergonomics. That's what madam is asking. Ergonomics can be only for the surgeon.
Yes.
So you cannot put a conclusion on ergonomics based on your study.
Yes.
Because ergonomics, the surgeon has to give his experience.
Yes, sir.
How did you arrive at the questionnaire? How did you validate the questionnaire?
Sir, actually, we have prepared the questionnaire basis on the experience of our vitreoretinal surgery.
There is, whenever you administer any questionnaire in any study, it need to be validated first.
Yes, sir.
Otherwise, the structured questions, whether it will yield a reliable result or not, is uncertain. So you need to validate any questionnaire which you are administering. That was done or not done. Answer is yes or no.
No, I am not validating that.
You need to put the questionnaire with each Likert scale for each question has to be mentioned. I think in your full text also there is no mention of that. Each question and what was the Likert scale for each question. How many percentage of said strongly agreed, how many said strongly disagree, all that is important. That all those details should be given.
I have put it the percentage of the participant.
You have only 5 observers in each group, right? The numbers are also
Yeah.
too small.
Total, sir, 10 observers.
So these numbers are also too small to come to any conclusion.
Yes, sir.
See, the
Always.
questions are also so different, no? You are analyzing the surgeon and analyzing the participant, discomfort, stereopsis. So each question is a separate thing. You have to give each separately statistics for each question. You cannot club everything together and say 70% were okay with the questions.
That's where validation comes. The weightage of the questions will be given. Thank you very much. Yeah. Now is Madhurima Kumar is ready? Yeah.
Most of these are theses.